Welcome to the webinar on Poverty, Hunger and Disability, the Missing Link. This is the fourth in the series of webinars, which we've been doing from the last years. And we are focusing, today we are focusing on towards living independently in community with dignity for all persons with disabilities. Our next presenter will be Anil Patil. Anil has over 25 years of experience in the international development sector as veterinarian, development practitioner, grant maker, and trustee. Anil established Carers Worldwide in 2012, using his personal experience and passion to transform the lives of unpaid family carers in low and middle income countries, acting as catalyst through a partnership approach. Currently chair of the structure and funding working groups of the International Alliance of Carer Organization, Anil's work and its huge potential for social impact has resulted in him being the recipient of several awards, notably the International Ashoka Fellowship.
So now I would like to take you to the other side of the coin, which is family carers who play a significant role in terms of rehabilitation and empowerment, whole advocacy work, and they play a very, very vital role. Unfortunately, the caring has, even though it is, they are very proud to be caring for someone they love dearly, but it is having a huge impact on their own health and well-being, economic situation, physical health, emotional health. So I will be sharing about our work with family carers in India, Nepal, and Bangladesh. And I'm delighted one of our partner organization is also here, Sacred, Mr. Tippanna, with whom we have been working last 10 years. And delighted to see Naveen's video and how her mother is able to provide that support, and now he is able to go to school, and the transformation it has been for both of them. So when I talk about carers, what do we mean by carers? So it is a very broad definition we use. Carers means an individual of any age who cares for or nurses a relative, friend, or a partner, requires help due to physical, mental health, and disability and all. It's not just only disability, but also on the elderly and substance misuse, palliative care, and all. Friends, in low and middle income countries, carers are invisible. Earlier, Rajaram was talking about how the mental health is being invisible, and they feel more isolated and they are vulnerable as well. So impact of caring, the issues and challenges carers are facing, huge issues are there. Is a huge list of things are there, but I have picked up few things. One is health is being impacted significantly, their own health, physical, mental health, emotional health. There are family issues, relationship issues are there, and significant impact on their finances. If they are working, they are losing a job, unable to hold the job, and reduction in earning. And there are so many young carers are there, no fault of their own, end up caring for either siblings or parents. Due to that, they're missing out their vital education. One side we talk about right to education, other side these children, young carers, child carers are missing from their vital education. Of course, having a significant reduction in their social contacts, unable to carry on social commitments. So I want all of you to spend just 30 seconds on this slide. In India, for example, we have a population of more than 1.4 billion population, and this is the 2011 census statistics. More than 12 million people are with severe mental illness, and people with dementia, and people with disabilities. All of these adults and children, all of them have a carers. But we just don't know how many carers are there in India. On the contrary, in the West, for example, in UK, there are more than 6.5 million family carers are there. 1 in every 8 adults are carers. The contribution made by the carers to UK economy is 193 billion. That is the study done by London School of Economics and other carers organization in UK. If I apply that statistic to Indian context, friends, there is going to be minimum 170 million carers in India alone, 2.5 times the size of Karnataka population, only carers, but we just don't know how many are there. WHO, World Health Organization forecast by 2030, there is going to be 400% increased in need for carers. So what I'm trying to paint a picture here is we are literally sitting on a bubble. We don't know when that bubble is going to burst. It is time for us not just to provide the support to a person needing the care, but also please include carers, not just to transform the skills and provide the information whom they're caring, but also address their own issues and challenges and difficulties they are facing day in, day out. Then you are addressing both sides of the coin. Then you are enriching the family environment within the community. So in the absence of statistics, we started collecting the data in South Asia. Just to give you 89% of carers are feeling anxious and depressed. One side, people who have been identified and diagnosed with mental health, they are receiving the support. Other side, family carers are having that experience. There is no support. If we don't provide the support to them, they would become the users of the mental health services. Already the infrastructure is not that well developed. So 92% of carers are worried about the finances. And there is no concept of respite or a short break. Like you and I, if it is a Saturday and Sunday or any festival, we take time off, spend time with the family members. Unfortunately for carers, they don't have that option. They can't go out and spend time with friends or other family members or relatives. So this is the situation. Again, majority of carers are women. 84% of carers are women. In some countries, for example, in Bangladesh, 97% of carers are women caring for their loved one. And many of those carers are elderly women. Again, they themselves need a help, support, and assistance. They are burdened with caring for someone they love dearly. This is real situation. So it is so important. What I call as is carers are partners in care. Please, I want everybody on this virtual platform to just to think and reflect within your own families or within your community, not just to focus only on person needing the care, but also include the carers. And of course, we all know how important the professional's role is. I would say that 80 to 85% of the work is done by the family carers. And we as a professionals, maybe 10 or 15%. When the changes have occurred, I'm taking entire credit. We're not giving the credit to the carers. So if you just start recognizing that critical role they are playing and appreciating, then really magic happens right in front of you. So in 2012, with that background, I established this Carers Worldwide. We are still the only organization strategically, not just raising the awareness of the needs of unpaid family carers, but also providing the support to carers through our partner organizations. I'm going to skip our vision and mission statement. We have very ambitious vision and mission. You will be able to read through our website. We have all that information available. So we act as a catalyst to bring systemic changes in the countries where we are working by building the evidence, by working with policymakers and other academicians and all. And the second one is changing the attitudes in the community or families and promoting support for carers.
You have 2 minutes.
Sure. This is a simple model I have come up with to address those issues. So one is carer support groups, how we can reduce their loneliness and isolation. For that, we have promoted more than 750 such groups are operating in 3 countries now. 92% of carers are participating in that and feeling we are connected, and support system has been established and making caring visible. To address the carers' health issues, we organize a specific health camp, whether it is mental health or general health camp. Even more than 400 carers have been trained as barefoot counselors, and each barefoot counselor is connected to another 20 carers. In that way, we're able to address their emotional health issues. And we have promoted more than 30 community caring center. Through that, we are offering respite and a short break during the daytime. And when we started the work, only 30% of carers had a regular income. Today, more than 80% of carers are earning an income along with the caring responsibilities. And finally, we promoted a platform for carers to advocate for their rights, advocate for their needs, advocate for the services. We have 15 carers organization, registered organization, and 2 exclusive carers cooperatives to address their financial sustainability issues. So here is our impact. You can look at before and after. And when we started work, 97% of carers were living below poverty line. Now it has come down to 22%. And 61% of carers were having depression and anxiety. That number has come down to 9%. These are independent evaluation done. And recently we commissioned last year about the impact of our work in all the 3 countries and the return on social investment. Every pound, every 100 rupees investment return is nearly 800 rupees. This is again an independent evaluation carried out by MZN International, which is a European consultancy firm. So friends, I just want to take another 1 minute. So in terms of systemic changes, we were instrumental in bringing 2 landmark policy changes, particularly from the carers' point of view. Rights of Persons with Disabilities Act 2016 and Mental Health Bill Act 2017. For the first time in history of India, both of those act recognizes support to caregivers. And you will be delighted to know Karnataka government has recognized carers worldwide as a nodal agencies, and through our work last 3-4 years, and Karnataka government is providing caregivers allowance. Of course, it is at a district level, headquarter happening. We want that to happen in everywhere. More than 6,000 carers were able to receive that allowance. And we also advocated and promoting caring itself is a job under Mahatma Gandhi National Rural Employment Guarantee Act. And through that, more than 8,000 carers were able to access. Of course, now the file is at the central government. We hope that during this year, they will be able to discuss and review and hopefully issue a new guidelines. And in Karnataka, again, 5% reserve fund at panchayat level being used to support economic empowerment of carers. So friends, what I'm trying to say is our intervention is like a drop of ink in a bucket full of water. You don't need a whole bottle of ink to change the color. Just a little bit of support, really magic happens right in. So our learning has been to healthcare system, carers are the unpaid army keeping everything going on. To service providers, they are the potential catalyst to therapy success. To doctors, they are the expert by experience turning treatment plan into realities. And to the patient, they are the indispensable mother, husband, wife that make each day possible. We started with just 250 carers. Today, we have transformed the lives of more than 150,000 in just 10 years' time. And we have a very ambitious plan by 2030 to reach more than 10 million carers. Thank you. Thank you so much.
Are you working with the government to play the role of carers and also working on social model? Working on social model so that the need for individual caring is minimized to a certain level. So that is to understanding.
Thank you, Rajaram, for that questions. Yes, so we are working with the government, particularly in Karnataka state, I would say. Very closely, we are working with the Karnataka government. As I said, we made several recommendations and guidelines provided to Karnataka government. You will be delighted to know, because of our work and Karnataka government were able to see our work on the ground, and this year they have just issued a draft letter to us saying that they are going to promote more than 6,500 carers group in Karnataka. to not just to make visible, but how they can support and connect with each other. And again, Tamil Nadu government just recently started providing the carers allowance. Last month, they have issued a order like 1,000 rupees for people with the severe disabilities and severe mental illness. In terms of social care, that is what we are working towards. That is part of our plan. So we are going one step at a time. And would be more than happy to hear from you as well, Razul.
Thank you.
In India, we are working in Karnataka, Andhra, Tamil Nadu, Jharkhand, and Odisha, 5 states.
Okay.
You mentioned about care allowance. I just wanted to understand who qualify for this allowance and what is the qualification? How do they qualify for someone to receive this care allowance? Thank you.
Yeah, thank you so much for that question. At the moment, it is carers who are caring severe disabilities who are given a certificate more than 70% and above. They are the one qualified and living below poverty line.
This is from Smitha Sadasivan. Is it the same in all states for carers of people with more than 75% disabilities or in certain states?
Yeah, no, unfortunately, it is not everywhere. It is just in Karnataka state. So we are taking that experience and learning to other states as well. At the moment, it is in Karnataka and Tamil Nadu.
Okay, there is one more question in the chat. Do you work in Uganda, the carers worldwide?
That is part of our next strategic plan, and we'll be delighted to meet with you. And certainly, we have a plan to expand our work in other Commonwealth countries. So
Thanks.
by 2030, we want to work in 20 countries.